Thank you so much for your time, first of all. Dr. Mordkin, you have an extensive background in urological surgery and have been at the foremost and forefront of innovative procedures. Could you tell us about the journey that led you to specialize in laparoscopic and robotic surgery for bladder, kidney, prostate, and adrenal cancer?
Of course, thank you for the opportunity to speak with you today. I've been passionate about being a physician, about being a surgeon for well more than 20 years. And in the early days of my career, most, if not all, surgery in urology was done as traditional surgery or as open surgery. So we used to make big incisions in the abdomen and put our hands in and operate. And well, it certainly was a part of surgery that I enjoyed and I feel I excelled at. It became obvious that from the patient experience, those larger incisions were, of course, pretty uncomfortable, and that translated into prolonged recoveries, needing to be hospitalized for sometimes several days, depending on the type of surgery we were doing. And as well, they were also associated with a fair amount of blood loss, which of course was not ideal for the patient. And so as technology improved over the last 20 to 25 years, and the ability to use cameras in the abdomen for laparoscopy and some of the laparoscopic tools, this allowed us to move the surgery from having to have our hands inside the patient to being able to do the operation with our hands outside on a television screen. And for the patient, this is really revolutionary in the sense that because the incisions were smaller, there was much less discomfort. This translated into a much quicker recovery, shorter hospitalization times, and patients were just, of course, happier by comparison. And as well, it definitely, depending on the surgery we're talking about, decreased often in how much blood loss would occur in the operating room, which was also ultimately beneficial for the patient.
You've been recognized as a pioneer in laparoscopic urology, even performing the first laparoscopic prostatectomy in Washington, D.C. How did you approach embracing new techniques and technologies in urology, and how have they impacted patient outcomes?
Yeah, so I've always been, I've always enjoyed the challenge of trying to push the envelope a little bit. Of course, you have to always balance that with making sure that we're adhering to established science, that we are adhering to patient safety first and foremost. But certainly, if we don't think about innovative ways in whatever profession we're in, we're never going to make progress, we're never going to move things ahead. And so, again, as I was mentioning earlier, as the technologies improve, the opportunities for us to take surgeries that have been done for decades in a certain way and see if we could adapt these new technologies to be able to accomplish the same surgeries was something that I've always enjoyed the challenge. And so, over the last 20 some years, I've focused on trying to do that in certain avenues. As you mentioned, I did the first laparoscopic prostatectomy in Washington, D.C. Many years ago now. And that first operation was very, very difficult. I think back to those days, and I remember that first day taking an operation which I had been doing for years as a traditional open surgery, that I could do that operation in maybe an hour and a half or 2 hours. And that first day, that first laparoscopic case took almost 9 hours. And I thought, my God, I'm crazy. On the other hand, that same patient who had a 9-hour surgery went home the next morning from the hospital. And I had never in my career had a patient go home the next morning from the traditional surgery. So I immediately saw the tangible benefit to the patient, even though for me as a surgeon, it was a more challenging operation. And so then it just required staying committed to the technology and staying committed to refining the technique. Like anything in life, the first time you try it, it's a little hard. The next time it gets a little bit better. You try new things, you try new approaches, and eventually you can get to a point of comfort and confidence.
Having served in both academic and private practice setting, what technique or unique insights have you gained from your experiences as an associate professor at Georgetown and your current role as chief of urology at Virginia Hospital Center, and how do these roles complete your passion for urological surgery?
Well, I think it's important for all of us to keep in mind as professionals in whatever avenue we work in that we are fortunate enough to do what we do because of the work of people that have gone before us. There's a saying, of course, that we stand on the shoulders of giants, and so certainly within my own career, I would not have been interested in going into surgery and specifically going into urology if I had not been influenced by people that were accomplished and ultimately became my mentors. And so I have always been cognizant of that, and I want to serve as a mentor for others as well. So being involved in academics has always been important to me as a result of that. First at Georgetown when I was on the faculty there, and now more recently as I've taken on a role as a faculty member at the Uniformed Services facility here in Washington, D.C. in Bethesda, Maryland, that trains surgeons and residents for the military. I've enjoyed very much training those people, seeing them grow, but they have also challenged me because they are young, because they are very in tune with technology. They're often pushing me to learn things that they're in fact seeing in their daily lives. And so honestly, as much as I can enrich them and their experience and help to train them to be the next generation, they keep me on my toes and keep me pushing forward as well.
Your involvement with the Da Vinci robot and your expertise in robotic-assisted surgeries have been instrumental in treating prostate and kidney cancers. Can you share some of the most significant advancements you've witnessed in this field and their implications for patients?
Yeah, I think I mentioned earlier that when we moved from traditional open surgeries to laparoscopy, while these were challenging operations to first learn as we began to define the techniques that were necessary, we did see immediate improvements or immediate advantages to our patients. Smaller incisions, less pain, less time in the hospital, less blood loss. When the Da Vinci robot then became available in approximately 2003, 2004, that just furthered that much more quickly. And so what I've been seeing is, for patients that I operate on with cancers of the kidney, of the bladder, of the prostate, we're still in many of those instances being able to do these operations using the Da Vinci technology, which allows us to be extremely precise in the surgery. And that then translates into dramatically less blood loss, better opportunity to see the structures that we're operating on, and then, my gosh, still get patients out of the hospital the next morning. I mean, just yesterday, we did we operated on 2 patients with prostate cancer, a patient with kidney cancer. All 3 of those patients are already home, and we're not even 24 hours from their surgery. So I think, to me, that's pretty dramatic in terms of what we used to see, where it would be weeks of recovery. Now it's really more a matter of several days.
The concept of single port access technique for surgeries is intriguing. Could you elaborate on the challenges and benefits associated with performing laparoscopic nephrectomy, partial nephrectomy, and suprapubic prostatectomy through a single port access approach?
Yeah, you're right. The idea of single port surgery is very intriguing. It's been very intriguing to me for probably more than 15 years now. And we have certainly here in my institution and myself have done some single port surgeries. I think the challenge continues to be really one of the technology that's available. And so while we have proven that we can do many operations, some of which you mentioned, as single site or single port surgeries, which means instead of making 4 or 5 holes and having instruments come in from different directions, putting everything through one small hole and then doing the surgery internally. While we've proven that it's doable that way, the limitations of the technology still make those surgeries very, very cumbersome and very difficult, which then limits their utility, because oftentimes it can take many, many extra hours to do a surgery like that versus compared to the traditional robotic or traditional laparoscopy. Intuitive Surgical Da Vinci robot manufacturer does have a single port technology available now. I have utilized it to some extent, and while it is exciting, I think that we're still probably 1 or 2 generations of the technology away from it being to a point where it's going to be more widely accepted. But that day will come soon enough. So,
Romania's healthcare system is evolving, and technological advancements play a role in shaping its future. From your perspective, how can medical professionals in Romania work towards integrating cutting-edge procedures while ensuring accessibility for a diverse patient population?
That's a great question. I think first and foremost, anybody who is contemplating or is finding themselves in a position where they need surgery needs to appreciate that the operations that have been done in the more traditional open way for many, many, many years are still very good operations. So no one should walk away from this conversation thinking that if they don't have access to a Da Vinci or they don't have access to a laparoscopy, that the surgery that they're going to get is somehow inferior. Ultimately, that surgery will get them the therapy that they need. The difference is that their recovery may be more difficult than if they were to have had it done robotically or laparoscopically. And so I think that, for physicians that are in areas where they don't perhaps have as ready access to the technology, in today's world with all of the information that's available on the internet and YouTube and all these different methodologies to learn, just the idea that they're continuing to be aware of these methodologies that are out there, continuing to try to engage them and try to learn, to come visit those of us that are fortunate enough to have these technologies close at hand, will allow them to not only take some of those skills back to what they're doing in their home area or their home countries, but also when the time and hopefully the resources become available for them to have that technology, they're already familiar with it and they can jump on board very, very quickly.
And with your vast experience, what advice would you give to aspiring urological surgeons who are looking to make significant contributions to the field and provide innovative solutions to complex urological issues?
So I think my advice is probably not just limited to to urology. I think my advice is to physicians anywhere. The great thing about medicine as a profession and as a career is not only are you every day getting to help a person, help an individual, help people. And that's something that, every day when you go home at the end of the day, you can put your head on the pillow knowing that with satisfaction that you were able to help another human being. But the other part of it that's so exciting is that our learning never ends. Our learning never stops. Because of technology, because of innovative things that are being done all over the world, both in terms of equipment in the operating room, but also advents in genomics and genetics testing and other lab diagnostics and the new imaging modalities that are always being perfected. Your job as a physician, your learning is never done. You will always be learning something new. You will always be trying something new. And so it's always going to be fresh. Yes, as you do it more and more, you become more comfortable, more familiar with certain aspects. But my learning will never end, and I'm sure will continue well past even the day that I finally decide that I can't do it anymore, which I hope is still many, 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 many years down the road.
Thank you so much. It was an honor interviewing you and getting to know you.
Pleasure's mine. Thank you.
Thank you.